Good evening. I thank God for yet another time to be able to come to us with this conversation this evening. I'm happy to see all of you that have joined us on Zoom and those who are joining us on online, that is on Facebook Live, and those that will be joining us later on Zoom. So thank you so much for being a part of this psychoeducation. I know this is going to be an impact that is going to touch many lives. It's going to help us even be able to relate with people better and to support those who are having mental health challenges. My name is Anne Karambu. I am a counseling psychologist in Salem Consultants. In Salem Consultants, we offer counseling services. We offer health talks. We support those who are having challenges with mental health. And we believe that even through these platforms, we will be a support system for that person who may be going through the challenges with their mental health. So today our topic is being able to how do I support as a caregiver? How do I become a support system for that person who has mental illness? I remember last time we defined mental illness, and we also were able to define mental disorder. And our very first one, we were trying to understand mental health. And because, of course, these are people that we live with. Sometimes it may even be ourselves. We may find ourselves in those spaces where we may be struggling with depression, anxiety, or maybe other mental illnesses. So it is important to get to know, what is this that I'm supposed to do? How am I supposed to support? How am I supposed to be of help to that person? So supporting someone with mental illnesses requires empathy, patience, and understanding. It requires empathy, patience, and understanding. Now, maybe let me explain sympathy, empathy, and not sympathy. I know most of the times when we are interacting with a sick person, we are likely to offer sympathy. And sympathy is when you feel with the person, you're trying to feel the way the person is feeling, or you're almost getting into their feelings. Now, remember, now being a caregiver or a supporter, you're the one who is offering support. And if this person is crying and you're also crying, definitely you will not be able to support them. Or if they are not able to completely take care of themselves, and you also get into the same space, it becomes very hard to become a support system. So empathy has to do with trying to fit in their shoes, understanding the state that person is in, and trying to fit in their shoes. You may not really feel what they are feeling, but you can be able to try and understand what is this that they are going through. The next requirement is patience. A person who has mental health issues can be sometimes very repetitive. If they were talking about anger, they may be talking about it today, tomorrow, and the day after. If they're talking about unforgiveness, they will linger in that place. So as a support system or a caregiver, you require a lot of patience. Allow me to just bring in this, even as we discuss, maybe to just mention mental health challenge like addiction. When you're dealing with a person with addiction, on many occasions we find ourselves wanting a quick fix. Like we want this person to get healed very fast, and this causes frustration on the caregiver. And you can imagine now a caregiver who is frustrated, how frustrated the situation can be. So it can be very challenging to be able to offer that kind of support. So it is important to make sure that we are in a position to understand or have enough patience to be able to support this person. So empathy, patience, very important. The next point is being able to understand. Do you understand mental illness? Do you know what is this that this person is suffering from? One of the things I've realized is that we are quick to associate mental illness to demonic attack or oppression of the devil, because maybe that is what we understand where we are. So the quickest intervention that most of the times people who have mental health issues are given is maybe taken for deliverance, or taken to some exorcist, or taken to some witch doctor. And of course, the truth is that they will not be able to get help. And we are talking of cases like depression. We are talking of panic attacks that sometimes can come even in the form of somebody fainting. Sometimes the panic attack comes and someone can even remain unconscious for some time, or can pace in a room the whole night and they're not able to sleep. These are the kind of situations we are talking about. So sometimes when the caregiver does not understand what is this that this person is going through, it becomes a big challenge to be able to support. Sorry, I understand I'm not very clear. Let me try, make sure I am audible. Okay, can you hear me well? Maybe let me hear it from someone else. It may not be, it may be somebody who, can you hear me well? Let me hear a response from somebody else. Evelyn, can you hear me well? Okay, Laureate, thank you. You can hear me without breaking. Okay, Emmy, kindly check your network. It may be the problem. Others can be able to hear me well. Good. So I was saying that when we don't understand mental illness, we find ourselves misdiagnosing or even offering support that is unnecessary. We have seen people with mental health issues being taken maybe to be prayed for, and this is done for a long time. And of course, when we do that for a long time and it is not helping support, then we almost become a hindrance to that person getting help. So it is important to understand what is this particular issue the person is going through. Sometimes it is important to take them to the doctors. When they are seeing the doctor, please go with them. Let the doctor explain exactly what the person is going through. Or maybe when they are seeing a therapist, it is important to know what is this that the person is going through. And by that, then we will be able to offer the right support. So I said three things that are very important. Number one is we must be able to have empathy, get into their shoes, understand, get into the situation they are in. Imagine if you are where they are and how you would support. I will still use the example of a person in addiction. When we look at that person who is struggling with addiction, sometimes just ask yourself, if you were the one in that position, how would you want to be treated? The next one that we said is that people with mental health illnesses can sometimes be, it can be very hard even to support them. It can be very hard, and sometimes when we have very high expectations on them and their healing process, sometimes you can be frustrated along the way. I have been in therapy with people for 4 years. Some have come, and in 1 or 2 months' time, they're good. There are those that come and we have a conversation for 1 or 2 days, and they're okay and they're healed. But there are others that will take even several years to be able to come out of the situation they're in. So patience is key. Then the other part I said, understanding, being able to understand what is this that I am dealing with? What exactly is this person going through? So that we don't find ourselves giving wrong intervention or support. So the very first thing that we need to do is being able to indicate ourselves. I am talking about the support system, the person who is offering support for that person with mental health illnesses or mental illnesses. When I don't understand, I don't know what exactly this is. So learn about specific mental conditions, get to familiarize yourself with what is this that happens when someone is having these conditions. Last time we talked about depression, we mentioned anxiety, we mentioned bipolar disorder, which sometimes even we mention and say we have them, while really we may not be able to know exactly what illness is that is affecting us. We said this can only be diagnosed by a professional doctor in the area of mental health. So it's good to understand the experiences and the challenges that that person is going through. It is also important to get to know the signs and symptoms. What are you looking at? Sometimes we label people bipolar, or we label them and say that they have depression. And sometimes it may not be that. So it is important also not, and it's also good not to call people mad and use very nasty words on them. I have seen this a lot, even in our social media platforms. I have realized there's a lot of bullying in the area of mental health, mental illnesses, and I don't know whether it is because we don't understand or it's because we don't know what we are supposed to do. If I find a person along the way, if I find a person who has a broken leg, and because their leg is broken, they are not able to walk properly, I have not seen people laugh at a person who is sick and has a broken leg. But we really condemn and criticize people who are mentally ill. And sometimes, especially in this era of social media, we see I might be sick and I might decide to take my TikTok account and I will use it to be the one that I'm expressing what I am feeling within. So when we see such people, and of course you are able to identify there's something amiss about them, please don't comment. You don't have to say something nasty, because the much you're doing is just hurting that person more. So sometimes even family members are not able to understand, and especially people in addiction. I said addiction is a mental illness. People in addiction receive a lot of hate from family members. And sometimes I feel it's because we don't understand. We don't really know what they're going through. And I have seen people who are struggling so hard to heal, going back to the same painful experiences because of statements that have been made by family members or people close to them who did not understand what exactly these people were going through. So it is important to understand. It is important to be able to be empathetic. We said understanding and patient. Remember, we were saying educate yourself. That is the first point. Be able to know, how does a person who is going through these challenges behave, and what is this that they do? The second point is listen without judging. listen without judging. A person who has a mental illness sometimes may talk things that are out of the ordinary, and sometimes may even talk about things that don't exist. Caregivers and people close to them, we are very quick to be very harsh on people, and even sometimes we shut them down. But remember, this person is sick. I said, I cannot shut down a person who requires surgery, or maybe who has just come from a surgical procedure. This is a physical illness, so it is easy to offer support. But because this is a mental illness that is not physically seen, sometimes we find ourselves not being able to offer support because we want to offer quick judgments on even their statements or how they behave. So offer a safe space for them to express their feelings without fear or criticism or dismissal. So when someone comes and tells you, today I'm feeling very sad, and I don't even think I want to live anymore, the quick response should not be, what is this that can make you end your life? I cannot end my life because of things people have done. I have chosen to be this and this. Remember, this is how this person is feeling. And for them, that time, it is a big deal. So you cannot shut them down or dismiss their feelings, because their feelings are not your feelings. And I know, of course, as we have this conversation, it's such a heavy space for somebody to be, especially when you're dealing with someone who has mental illness. It is such a heavy space to be. But when we educate ourselves and when we learn how to listen without judging, and also offering unsolicited help, that will really help even that person feeling supported. Sometimes just listen, nod, shake your head as they're talking. Let them feel that you're present. Again, don't allow them to talk. Maybe you're scrolling the phone, or you are on maybe a social media app, and you're doing your thing. And the person is there trying to talk, but of course, they can be able to tell they're not being listened to. The third part is be patient. Ooh, if it is there's an illness that requires a lot of patience, it is this. Remember, even as we say patience, it can even challenge our mental illness ourselves as we support. And that's why it is very important to be able to be educated. Because when we are educated, we will learn how to be empathetic and not sympathetic. When we are sympathetic, we also become sick like them. But when we are able to be empathetic, we can be able to understand the situation they're in and not really find ourselves fully consumed in them. Kindly, if we don't join with our cameras on, so that we don't distract the conversation online. So thank you. Yes, I was saying be patient. There must be a way we can just be able to be patient as we hold the hand of these people. Recovery or management of mental illness is often a long process with ups and downs. Of course, today they may be whole, tomorrow they are down. 3 weeks, very good, or 1 month, doing very well. Before you know it, the person has relapsed, and it can be very frustrating for the caregiver and the person giving support. So, of course, avoid giving them pressure to get better quickly. When a patient, I'll still use that patient with a broken leg. We don't tell the person with a broken leg, get healed very fast so that you can go back to your normal work. Some take 2 years, others take a year, others take 6 months, and they're fully healed. Now, I said because mental illness is not physical, it's not something we can see. We are not even seeing progress in terms of healing process. So sometimes it can be very frustrating, and the caregiver can find themselves like forcing healing on the person, or even thinking that the person is pretending. Learn to celebrate small victories and progress, no matter how minor they may be. Maybe somebody was not able to shower. Celebrate that. Maybe they were not able to even make their bed. Let that be something that you're celebrating as they continue healing slowly. Maybe it was just being able to have a conversation with people, and you realize they can now make meaningful conversations. That is something to celebrate. They may not be able to have gone back to work because their mind is not stable enough to be able to work, but at least they are able to have a conversation or a healthy conversation with other people. So we said, be patient. Be patient. I know it is not easy. Even when I am saying be patient, it is not easy. I have taken care. Okay, being also a therapist, we do this a lot, almost every other day. And sometimes, of course, it's such a overwhelming state. But of course, being also that we are trained to be able to handle, you're not as overwhelmed as someone who does not know. That's why I said educate yourself. But I've also had an opportunity of really taking care of a person that was ill, mentally ill for several years, and it was not easy. Today, the person is healed. Tomorrow, they're back to almost the same place they were in. It's like nothing had happened at all. And you have to pick from there and continue encouraging them. Offer practical support. Always offer practical support, help with daily tasks if they are feeling overwhelmed, cooking, cleaning, running errands. Encourage them to maintain a routine which can provide stability and structure. Don't, of course, allow them to like sleep the whole day. Even if they are able to just do 2 tasks in a day, like just waking up, taking a shower, spread their bed, that is enough. Are able to at least go through a few procedures. One of the things that is highly affected by mental illness is structure or schedule, daily schedules. A person who is mentally ill just wants to sit there, not talk to anyone, but just stay there. I mean, do nothing. So it is important to be able to help them create a schedule and be patient enough to be able to follow through the schedule. And of course, being able to assist them do things that they are not able to do, like cleaning. Don't, of course, make them just stay in a dirty environment or in a place that is not, it's unkept, simply because they are unwell. So it's good to offer practical support. The next one, of course, is encourage professional help. Anytime you realize you're getting overwhelmed and you cannot be able to offer the support that is needed, it is important to get professional help. But remember, even when this person goes to the doctor, they need to come back to a place that is safe, to a place that they are not judged, to a place where they can be understood, to a place that they will be allowed to heal gradually. So yes, we can take them to the professionals. That is a counselor, a psychiatrist, a psychologist. We will take them there, but still we need to offer them support. We need to be there for them. And it is very good to, as they get to see the doctors, it's good to also go in there and be guided on support, on how to hold their hands through the journey. The things I'm talking about here, they quicken the healing process. As much as we are able to be supportive, we are patient with them, we are not judgmental, We understand their illness. We are taking them to a professional, a doctor, counselor, or a psychologist. When we are able to do this, what happens is that the healing process will be faster than it would have been when this person who is mentally ill is left on her or herself or himself. Make sure, of course, you stay connected, regularly check in with them, even if it's just a simple text or call to let them know you care. People who with mental illnesses are highly misunderstood because someone is not able to understand when they are in their normal state or when they are in their episodes. It's the episodes that are happening. So sometimes they can be very, very lonely because the world they're living is like almost clearly on their own. So if you know someone who is mentally ill, check on them frequently, or even somebody who is looking for, who is in counseling sessions or as is going through depression or anxiety or panic attacks. It's good to keep checking on them. That awareness that there is somebody who cares for them. I said this will fasten the healing process. Social isolation can worsen mental health. So your presence can be a big difference. The easiest thing a person who has a mental illness want to do is to isolate themselves. So when your presence is there, then this offers a great support. The next thing is that avoid stigmatizing language. Stigma. I mean, there's a lot of stigma surrounding mental illness. Avoid terms like the person is crazy, the person is mad, or they are weak. You treat a mental illness as you would a physical condition. I said we treat mental illness like we would physical illness. The same way we treat a person who is sick, and we know this is malaria, this is cancer, this is diabetes, hypertension. We should be able to treat a person with mental illness in the same way. We should not victimize them because of their behavior. Because the first thing that is distorted when someone is mentally ill is their mind, their speech, their behavior, actions. The person might have been very hardworking and all over the place, very vibrant, all of a sudden withdrawn, closed in, having hallucinations sometimes at night, speaking things that do not exist. That does not qualify that person to be called mad or crazy. And I am speaking this knowing very well, in our present time, especially because of social media, we have done a lot of victimizing people who are mentally ill, even people who have come out openly and said that they have mental health challenges. We constantly still, even after we have been told they are sick, we still victimize them with our language. And sometimes we make the healing process so difficult for them. I don't know. I am making this statement. I don't know whether to say it is ignorance. I don't know whether to say it is because we feel these are things that can never come to us. I don't know whether it is ignorance of mental health, mental illnesses. I am not really able to pick what makes us as a society stigmatize people with mental illness to this level. It is such a mess. And it has made so many people not be able even to come out and maybe share their stories or even go for help because they don't know, they don't want to be secluded from the society or the community or the family. And it makes the healing process of that particular patient very difficult. So even as we are having this conversation, I pray as we listen, as we hear, as we get these points, I pray that we will be more sensitive to people having mental illnesses. Take care of yourself, of course, as you offer support. I said it is very hard to take care of a person who is mentally ill because mostly their mind is not operating in the normal. There is a lot of back and forth remaining in the same place, and it can be very draining and tiring. So take breaks, take care of your personal mental health, make sure you're handling your emotions right. Make sure you get time to rest, to sleep, to rewind, have fun. I know sometimes it can be very hard to do that because you have to be with the person there most of the times. But if you can be able to get support from someone else, even if it's 2, 3 days, that would really be of great help to that particular patient. Because once you've taken care of yourself, then you come back stronger to be able to take care of this person that is ailing. Remember, if you don't take care of yourself, there is a likelihood of predisposing yourself to a mental illness also. So we are now having a complication of 2 mental illness patients. And of course, that is a complex situation. And I am talking this knowing that it can be even a child, a mother or a parent taking care of a child, or a spouse taking care of the other, or a situation of a child taking care of a parent. It can be that close. So it is important to take care of our own selves so that we can be able to take care of the patient. Of course, be aware of crisis situations, know the warning signs of mental health crisis, e.g., suicidal thoughts, self-harm, severe withdrawal. Be able to know and identify cases. I know when someone says, I will harm myself, sometimes we dismiss those statements, and it can be very detrimental to dismiss it and then it happens. So it is important to take care and get to know those warning signs so that we can be able to take care. Of course, have an emergency backup in case of such crisis. What do I do? Who am I supposed to call? Where can I get support in case such a thing happens? It's good to always have their doctor's phone call with you. It is good to have someone in your vicinity that you can easily call faster, so that in case somebody may be planning to do self-harm, then you can offer support. Again, now show unconditional support. Let them know you're there for them no matter what. Reassure them that their mental illness doesn't define them and that they are valued and loved. It is good for them to hear. Please, I know we are Africans. I know we are not very good in communicating love in words. Please speak it. Let them hear it. Let them you telling them that I am here and I love you and I will take care of you. I am not going to leave you. As Africans, we want to demonstrate love with actions. Sometimes we want to do things and we are asking people, can't you see how I am dedicating myself? Can't you see I am here? Can't you see I cooked for you food? Can't you see I washed your clothes? No. Do the washing, do the cooking, be present, but also communicate it in words. Let them hear you speak it. Let them hear you assure them that they are not alone. Of course, be consistent, passionate, and present. Be consistent, compassionate, and present. I know some of these statements they don't look very doable, especially when you're dealing with that patient. But if we can transfer how we treat physical illness, because normally I see we offer a lot of care to a person who is physically sick. You see someone making fruits, making sure that they are clean, making sure that there is somebody with them throughout. You can even see somebody just going to talk to them around there. That is exactly the kind of care we are supposed to offer people who are also mentally ill. Another thing I would want to say is listen actively. I think I mentioned that when we were beginning. Listen actively, let them see that you are engaged in the conversation and what they are saying and what they are going through, and that you are present in that conversation. Learn to also set boundaries while supporting them. Ensure you are also taking care of yourself and recognize when you need to step back or seek support for yourself. As a caregiver, as a support, it is important also for you to seek professional help. Get professional help for yourself and also for you to know how to take care of the patient. Uh, Allow them to make their own decisions, respect their space because they are adults, just like the same way we don't force a patient who is physically ill, we also don't force this particular person who is mentally ill so that they don't feel controlled and manipulated. So allow them, respect their space, respect their decisions, of course, with support. If the what they want is logical, uh, encourage them, and of course, allow them to be themselves without feeling like they have been controlled and demeaned to nothing. Seek social support. Uh, Rally behind many people around you or around the patient. But as you rally around a group of people around you, let this not be a topic of discussion, that every cousins meeting, every family meeting, all we are discussing is how crazy this one has become. If you're rallying people, let them be people of the same support, people that are coming to offer support rather than people that are coming to tear down what you have already done. Remember, of course, your role is support and not to fix. Remember, your role is to offer support and not to fix their problem. So you're not the doctor. You're also not the one who is going to heal them. Your presence, understanding, and encouragement can make a significant difference in their journey towards recovery. So as we come, we are not coming to fix. And I know I wanted to give the example of people with addiction. Mostly because of that part of wanting to control, we find ourselves getting very frustrated. And sometimes before someone reaches to a level of addiction, they have maybe used that particular substance for several years. It runs to almost 15, 20 years for that person to get to the level of addiction. So that cannot be corrected in a day. It requires time. It might take time. And when we come and we are supporting them with the attitude of instant change and transformation, then we become very frustrated. And because we wanted to fix very fast, sometimes it strains the relationship to the level that it cannot even be recovered, yet we had come to offer support. So that is the much maybe we can say about this. The video will be on Facebook, it will be on YouTube. You can share with friends. Kindly, for those of you that are able to see, just go to Salem Media. You'll be able to see all these videos that we are making here, and also on Facebook. That is on Salem Consultants Facebook and Anne Karambu Mwangi Facebook. You can be able to get these videos and share with people that really need help. I feel like today we are having a hands-on conversation on matters mental illness, especially now that there is a lot of bullying. with the social media apps. Of course, sometimes the person who is mentally ill sometimes will go and share their story, and the backlash that comes from us in terms of comments. I just pray that this video reaches someone somewhere so that we can stop doing that, because we really don't help them. It is better you just listen to them and shut up and not comment anything. But when we comment with hurtful words, yet we are commenting on someone who is already sick, we are even compounding their problem more than it was. So I thank you so much for even being able to be a part of us, those that are on Zoom, Facebook, and those that will be listening to us later on YouTube. So thank you so much. See you next Tuesday as we have this conversation of being able to become the better version of me. Thank you. Amy, you're here with us?
Yes. I hope you can hear me clearly.
Yes, I
Thank
can
you
hear
so
you.
much. Yes, Madam K, that was such a very good topic, and we really appreciate what you have been able to give us. And it is such a pleasure, as always, for you to just give us that information. And we are very, very grateful, because what you have really come up with so many times is for us to be patient and for us to really consider and be sensitive and just be considerate of what we are speaking, especially to the people who are suffering the mental illness. So maybe we can answer 2 or 3 questions before we close today. You can tell us maybe, is it on the what is the description of a caregiver? Is it only limited to immediate family members, or is there a different definition?
Of course, we have a whole broad spectrum of support. We will begin with the counselor themselves. We will begin with the therapist. Of course, as we offer therapy also to these patients with mental health illnesses, the doctor, the psychologist, the nurse, the the person selling in the shop, the person who has rented their premises to this patient who is mentally ill, to the pastor of the patient, to the immediate now caregiver who is maybe a family member or a neighbor or a friend, a close friend. So it is a broad spectrum of people, because these are the people that this person is interacting with on a daily basis. And how we treat them determines, of course, how fast the person will heal and whether we are offering the right support, even as we interact with the person having mental health challenges.
Thank you for that, so that we don't just think that caregivers are limited only to immediate family members. Wow. So there's another one here who says, I find it difficult to create relationships. Is it possible to form other relationships from a caregiver point of view?
One of the things, remember, we said that as of course, as you're taking care of the person and as you're supporting them, there is this assurance that you keep giving the patient that I'm here, I am together with you. Lasting relationships have been made from such support systems. There are people who maybe have gone to a rehab, and because of maybe a certain person who was driving them to that place, because this person was listening to them and was loving and caring, meaningful relationships can be, of course, made from there. Remember, a person who has mental health issues, society has a way of just not being there. So the few that are supportive, they might also become very clingy on them. And sometimes it can be very hard now to dissociate yourself from dependency and being able to know that this is a friend. So again, also, even as the support, it is good to also not allow the person to be too dependent on you, to almost like be everything they do in life is like you are almost the one to decide what they are to do. They can become overly dependent on you. So you also don't want to create such a kind of support a relationship. So it's also important to take care of yourself so that you put right boundaries, and you are also not making this person almost stop their life and now they're living life according to the way you want it done.
Wow. Thank you. Thank you for that. It's important to
It
have
is
and
a tricky
maintain
balance. It's a very tricky
your
balance.
boundaries. Yeah. Wow, interesting. So someone sent in a question here and they said, I live with my autistic son and my husband left me after the diagnosis. How do I forgive him and accept what I am going through?
Um, those are now the ones we said mental disorders.
Hmm.
Remember, this is almost a now full-time caregiver. If there are people that need professional help, it
Mm-hmm.
is this category of people. Because when we talk about mental illness, it's something that can span for a short period of time. But when we talk about a mental disorder, we are talking about maybe someone who will be like that for the rest of their life. And the caregiver is supposed to take care of them like forever, and also run their own life and deal with their own emotions. So I would really highly recommend counseling and therapy for caregivers with people with mental disorders, like now the autistic child. But also, it is good to have an opportunity for a break. If there is someone else who can be able to stand in for you to be able to have some break and some time to at least have a breather, it is important and very necessary. Again, these are things also that come with so many strained relationship, especially in marriage. Mostly, I don't know why spouses tend to leave. It can happen either way. It can be the woman leaving or it can be the man leaving. It can be very painful. Again, these are some of the things that would really be taken, person will be taken through healing in a therapy session. So it is important you can't imagine carrying a burden of a patient with mental disorder and bitterness and unforgiveness at the same time. That is too heavy to carry.
Mm. So get yourself some support, just like you told us to be able to get yourself support so that you can just be able to navigate what you're going through at that time. And I think we can answer one final question before we close the session for tonight. And it reads, is it possible to shape your entire life and identity on taking care of someone?
Um, I want to believe it is possible to live a meaningful, thriving life and still take care of a patient, a long-term patient who has a mental illness. I know those two are possible, but what I know is you will require a lot of support. You will require a lot of external support from professional counselor, professional doctor. Make sure everything that you're doing is with a professional, so that you're not finding yourself getting help from quacks. I remember when I was beginning, I said there is a lot of exorcism, witchcraft, deliverance so many things associated with a patient of mental illness. If as the caregiver, that is the direction or the path you take, it can be very frustrating because they may be assuring of solutions, but you can be sure you'll be getting frustrations. So it is important to make sure that you're getting support from professionals. Yes, you can be able to live a meaningful life. And the best of it is that we have seen so many people who have taken care of patients with mental illnesses, and of course, any other patient, even draw purpose from that pain. Because the best thing is when we turn these things to God. When we turn them to God, He brings purpose even to that particular pain. So people have begun foundations, people have done great things just because of looking into this pain and connecting it to the purposes of God in our lives. But the worst direction you can get is when you find yourself going to the quacks. They will mess you up.
Wow. So find yourself professional help, emphasis on professional, and it's important to be able to just set your boundaries and be patient as well, because you really emphasized on not wanting to have a quick fix to matters of mental health and mental illness, and just being able to be consistent and sensitive to the matters of mental health as well. Maybe I can read a comment that has been written here. Someone has told us that this is such a helpful conversation and such an eye opener. So we really appreciate your time once again, Madam K, and the information that you just get to share with us in this particular psychoeducation, and just being able to apply these things to make them simplified for the rest of us to just understand what is going on in the area of mental health. So we really appreciate your time, and maybe you can just close the session for us for tonight. Thank you so much.
Thank you so much, Amy, for those questions. I believe they have brought clarity and confirmation on a number of issues. I don't know whether there's anyone in the Zoom who would want to comment or say something before we close. Maybe you can have an opportunity to just make a comment. Kindly, if you are able, unmute. Okay, it seems like there is none today. Thank you for your comments, of course, that you've given on the chat, and thank you for joining. Welcome every other Tuesday. Our conversations will be here. You can also feel free to also give us comments on the areas of conversation you would want us to have. Our prayer and desire is that we will be more aware in matters of mental wellness, and we will pass this information to other people, information that may not be as available as it is needed. So thank you so much for joining. See you next Tuesday, and have a blessed night.